Our mission is to ensure that malaria does not cause severe conditions in the environment, to avoid the consequences of poor knowledge in the area of public health that could put one's life at risk of getting malaria. Our vision: educate people about the significance of malaria, mortality, impact on life, and about what behavioral changes. For example, proper use of insecticide-treated mosquito nets, promote and support initiatives taken by local population, understand challenges experienced by healthcare facilities in delivering ongoing health education on prevention and control of malaria, empower and support health facilities to deliver effective sessions targeting the local population. Now, our action plan on achieving our mission: arrange weekly community meetings with community health workers, religious leaders, and youth groups on community-based education. Consistently demonstrate proper use of the nets to each household. Discuss the plan of malaria session with health facility staff. Participate in health education sessions and train health workers to deliver effective sessions by themselves.
So the reason why we have chosen malaria as a point of interest, and specifically in an African nation such as Kenya, is because malaria has one of the highest disease burdens of any infectious disease. And this burden is really only shouldered by a few nations, mostly within Africa. For example, 32 countries in sub-Saharan Africa shoulder about 93% of all malaria deaths globally. And around 4 countries, including Nigeria, the Democratic Republic of Congo, Tanzania, and Mozambique, account for just over half of all malaria deaths worldwide. So you can see that the burden of malaria really is centered around only a few countries. Malaria has a huge impact amongst these nations. It has impacts on sectors such as education, agriculture, investment, and these are just to name a few. And it's these nations who shoulder a lot of the burden of malaria that tend to already be lower economically developed countries that are hit harder by the economic burden. And there's a term that's been sort of used, which is called the growth penalty, where these countries don't get the investments, they don't have tourism because people are hesitant about malaria. So then it becomes harder for these governments in these countries to invest in ways to prevent the spread of malaria. And that is why it is so crucial for these African nations to be using the current preventative measures as effectively as possible. A little bit of background information on malaria. It is a parasitic infection which is caused by Plasmodium. By far the most common and most deadly parasite is the Plasmodium falciparum, slowly followed by the Plasmodium vivax. But in the continent of Africa, Plasmodium falciparum accounts for around 96% of infections. The disease can manifest as quickly as 7 days after being bitten by a mosquito. And the initial symptoms are very flu-like: high temperature, shivering, cold, headaches, vomiting, muscle pains, etc. And because it's so general, it's quite often hard to identify the malarial infection early on. But if you are infected with the Plasmodium falciparum parasite, then it will normally progress to a severe disease very shortly after that, which without prompt treatment can lead to breathing problems, organ failure, and anemia. There are many ways to treat and prevent malaria, the main ones being vaccines and chemotherapies, which can often be given prophylactically. Alongside this, we do have ways to control the vector, the mosquito, and this normally includes sprays or insecticide-treated nets. And even though these are proven to be an incredibly effective way to control the transmission of malaria from mosquitoes, compliance and correct use of the nets remains one of the big challenges. As it stands, WHO recommends that all people at risk of malaria should be sleeping under the insecticide-treated nets, particularly long-lasting insecticidal nets, every night. But it's important to acknowledge that education on how to use nets correctly, involving the community, and also making sure that there's a greater accessibility to the use of nets are some key factors in how effective the use of nets would be. And hopefully this poster and this research will provide more clarity on how this can be done.
Encouraging more people to sleep under treated bed nets in malaria pandemic in Kenya does not mean just about handing out more nets. Yes, there are research that said the results indicate that LLINS have significantly reduced the prevalence of malaria. And agreed, the government should not relevant its effort in the distribution of these nets. Although it's true that some villages, the nets are used to catch fishes. And also, Dr. Sugishita told us that some doesn't use nets because of the color. They prefer using pink nets rather than green nets because they use when they're at the sleep. Also, there are some comments that using nets during the summertime, the heat will circulate and they are uncomfortable sleeping. We, as a team, has a variety of backgrounds, including community health and two medical students. With that knowledge, we will be able to first conduct a field research on how the nets are used and what could be improvement. And from that, we could make our own regional group session to track health workers as well as people on a village how the nets are used, and also train them how the proper use of nets to continuously to tackle the malaria.
Malaria continues to be a threat to the lives of people living in Africa and specifically in the tropical region, and in Kenya to the people living along the lake region. Although a number of interventions have been implemented by the government and non-governmental organizations in Kenya, including distributions of nets, spraying of households, the desired results have not yet been met, and some of the external factors that has contributed to these unmet desired results include inadequate human resource at health facility level who can be able to promote health education on malaria prevention and control when patients come in to get the vaccine or to get the treatment. Then there is non-continuous of awareness creation and education on proper use of the ITNs. You find out that the ITNs, once they are given, then there is no that continuous, then non-compliance of policy implementers to adequately roll out the implementation process that support malaria reduction. However, some of the external and other factors that have continuously contributed to the reduction of prevalence include the funding that the Kenya get from other organizations and big NGOs, international NGOs, and we have also been using the mass media to communicate to the locals on the proper measures of malaria control and management.